السلام عليكم. أحب الأول أشكر دكتور أشرف شرقاوي for inviting me for this منصورة conference. إحنا طبعا متعودين كل سنة إن إحنا بنتقابل face to face في المنصورة مع دكتور أشرف ودكتورة أماني. I hope السنة الجاية إن شاء الله نبقى في المنصورة أهل الكرم. Today we are going to talk about the role of growth hormone injection device in improving patients' outcome. And thanks for Novo Nordisk for sponsoring this talk. First of all, I think most of us know this little boy in his football team. He was diagnosed as growth hormone deficiency and he started growth hormone therapy till he now became one of the famous football players worldwide. He is Messi. So it's a success, it's a journey. I hope all our children of growth hormone deficiency follow this success. So to have our target and to reach the final adult height of our children, we have to take care of the growth hormone treatment because growth hormone is like any other medication. It has two important items, either adherence or compliance. The adherence is the act of filling or refilling the prescription just on time. And compliance is the act of taking medication on schedule or as prescribed by the doctor. And here are their two important items that we have to take care of it. Why we have to take care of adherence? Because it's very important. As good adherence is leading to optimal response to growth hormone therapy. And we define poor adherence as having at least one dose missed per week, while moderate adherence with missing 2 doses per month. So take care because growth hormone has to be given daily subcutaneous injection. That's to say 7 days per week. So please don't miss even one dose. This is a study done in 216 talking about the adherence to growth hormone therapy in Spain. And they concluded that moderate to poor adherence was identified in about 33.5% of the patient. And I think if we did this study here, I think the percentage will be much higher. Why? Because the moderate to poor adherence will lead to negative impact on the growth. It will decrease the growth velocity standard deviation score by 61%. And also it will decrease the insulin growth factor 1 standard deviation score by 63% and affecting the final adult height. So please take care of the adherence. There are many factors affecting the adherence of growth hormone, being the chronicity of the disease, it's a chronic illness, duration, the longer the duration that maybe the adherence will be affected, it's self-administration, the patient age, either he is a little boy or adolescent, pubertal, either pre-pubertal or post-pubertal, if there is any technical or physical factors impacting the convenience of growth hormone therapy, also the educational level of the parents, either they are highly educated or with low socioeconomic class, if the patient is understanding and his psychological factors which affect the growth hormone. And finally, don't forget the doctor-patient relationship. This is another study done in 2016 talking about the burden of growth hormone therapy. They asked the children, the adolescents, the parents, and the doctors about the common issues during growth hormone treatment. About half of the patients of the children, 8 to 12 years, they said they suffer from the pain of injection daily, while half of the adolescents said that they suffer from the daily task. And 67% of the parents are worried because of the side effects of the therapy. And 34% of the doctor, they considered that the most difficult issue in managing the therapy was the family's daily task. So we have a lot of common issues that we have to work on it to improve the outcome of growth hormone therapy. Long-term administration of growth hormone has 3 main items: the inconvenience, the discomfort, and don't forget the pain of daily injection. So again, we have to work on these 3 items to improve the outcome of the patients. How do the injection pen device improve the adherence? Of course, it increases the convenience of growth hormone administration by simplifying the growth hormone injection daily. whenever it is easy, whenever it is simple, so I will be more adherent to my growth hormone injection. And of course, it will be child and user friendly. And the main goal to decrease the pain associated with injection. So if we fulfill these four criteria, the injection pen device will improve the adherence to growth hormone. And when we asked the patient about the reason for a missing a dose of growth hormone, they said they are just away from home. Either they are traveling or in weekend or in camps or in summer. So they said I am away from home, I can't take it, or for example, I miss it and I forgot it. Or they forgot to renew the prescription. The third reason about the pain of daily injection subcutaneous. One of the important reasons for missing a dose, no available fridge, especially during camps, during summer, during weekends, because as you all know, many of the growth hormone products has to be kept refrigerated from 2 to 8 degrees Celsius. And the fifth reason is about the device malfunctioning. Either there is something technical or something difficult during using the growth hormone device. Talking about the real world data about the device, how to improve the adherence, they found that there were less pain during injection. There are confidence in administering the right dose because many people have the issue. Either I give the right dose or not, either it is too small or too much bigger doses. Do I have the right dose, the right injection? So they are not confident about this. Also, the convenience of the device, if the device is so simple to use or there are complications. And finally, how do I am satisfied with the device? So again, the device or the growth hormone pen has to fulfill all these items. This is another study done in 2017 talking about the relation of pain with the adherence, and they concluded that less pain during injection was significantly associated with better adherence. This means that whenever I inject and there is less pain, so I will be more adherent to take my growth hormone therapy every day. Again, they concluded that the convenience in having administered the right dose improve the adherence. Again, when I am sure that I am taking the right dose of my growth hormone therapy, so I will be more adherent. I will not be afraid that I am injecting or withdrawing or calculating the dose wrongly. I am not afraid that the device is not giving me the accurate right dose. So whenever I am convenient, whenever I am will be more adherent to my growth hormone therapy. And finally, they concluded that convenience and satisfaction with the growth hormone device was significantly associated with better adherence. So this is a very important issue in the adherence of growth hormone. Now we are talking about a very important issue, which is the growth hormone and the refrigerator. Again, most of the growth hormone product has to be kept in the refrigerator from 2 to 8 degrees Celsius. And this is a very big issue, especially in adolescents, especially when they are traveling abroad, summer, when going to the beach, when they have camps. So they have to we have to make available a refrigerator or to take them in the icebox. So this is a very important issue. About 50% of the patients and the caregivers consider storage of growth hormone to be much more a burden during traveling. Very important. And about 82% of the patients agreed with the statement that they wish they could store growth hormone outside the refrigerator for a longer period of time. It's a very big issue. This is a study talking about and comparing the product that which was flexible in storage. This means we can store it either in the refrigerator or not, and they were stable at room temperature for 25 degrees Celsius. And the refrigerator only products, they compare both of them, and they found that the storage flexibility significantly had fewer missed injection than refrigerator only products, and adherence was significantly improved for storage flexible versus refrigerating only product users. Of course, when I am flexible, either to put it on the refrigerator or not, so I will not miss my injection. But if I have the issue that I have to put it in the refrigerator, so I may miss some injection due to unavailability of this refrigerator. The second item is the compliance, which is a very important arm in improving the final adult height in children, as the compliance will affect the linear growth and they will affect the final adult height. When we assess the compliance, the doctors asked for the growth hormone requested every month, and they checked the amount of growth hormone sent back from the patients, and also they calculated the growth velocity standard deviation score over 6 to 8 months to check and to assess the compliance. And we said there is high compliance when only missing one dose per week, but medium compliance if I miss about 2 doses per week, and low compliance if I miss 3 or more doses per week. So take care. If just you are saying, oh no, I will just only missing 1 or 2 doses per week, so no, you don't have a good compliance, and this will affect your final height. This is a study comparing between the compliance and the height velocity standard deviation score. And of course, they concluded that the height velocity standard deviation score is directly proportionate to the level of compliance. The more I am compliant to my growth hormone therapy, the more I will get for the height velocity standard deviation score. So this is a very important issue. Don't forget that there are many factors influence the choice of growth hormone injection device, especially from the economic perspective. As we all know, growth hormone is an expensive drug, but we have to weigh benefit versus cost ratio. We have to balance between them. And thanks that most of the growth hormone products are now available in the insurance, so we can get any of them and with a much lower prices than in the market. There are 3 items and 3 arms we have to take care of them: the cost, the benefit, and don't forget the wastage of growth hormone. Don't say that I will take the lower price or the more less expensive drug, but take care of your benefit. Take care of the final adult height. Take care of the gross velocity standard deviation score that you will get. And also, not only this benefit, you have to calculate the growth hormone wastage, because there are many wastage of growth hormone, either being during dose setting, if you are, for example, making it from a vial and you have to withdraw it with a syringe, or you have to calculate the cartridge and you put it back on the pen, or you have to calculate all this and you prepare this growth hormone dose. So you may waste your growth hormone, so you will decrease your cost or you increase the wastage. And also, you maybe wasted the growth hormone prior to injection in the needle or in the cartridge or in the device. So these are very important items. And here are some studies comparing the differences in the wastage between growth hormone devices, either between, for example, norditropin and other devices with 5 milligram or 10 milligram. And they calculated the growth hormone wastage with needle on prior to injection and growth hormone wastage during dose setting. And they found that in the USA setting, the annual wastage of norditropin is about 1 to 2.5 pens or cartridge per year, compared to 8 cartridge of the other products with 5 milligram devices. So it's a very big difference. You are wasting a lot of time. So please don't just to look at the price of the growth hormone you are giving. And also when they compared it with the other 10 milligram devices, they found that the annual wastage of norditropin is from 0.75 to 0.5 pens or cartridge per year, compared to 9 cartridge per year from the other products. So the wastage is a very important issue. To fulfill a perfect growth hormone device, you have to fulfill all these items: reliability, easy to use. It must be an easy to use it because you are going to use it daily. Minimal pain during injection. Please take care. Our children have to be given daily subcutaneous, so we have to decrease the pain during injection. Of course, safety in usage and in storage is a very important item. And also take care of the number of steps during preparation. How many steps I am going to do before giving my shot of growth hormone therapy. So these are the items that or features of the growth hormone device that I have to take care of it to be a perfect growth hormone. And actually, Norditropin Nordilet is fulfilling all these criteria, being easy to use and more convenient with no mixing, no loading. Of course, simply less painful with using of the advanced Novofine needles. It's simple, flexible with accurate dosing. It gives an accurate small dose increment. You have just by click, you can give smaller doses and you can calculate your doses very, very accurately. And one of the most important items is the easy storage because it is stable up to 25 degrees Celsius, so it doesn't have to be put on the refrigerator other than the most other common growth hormone devices. So it's very important that when you have this growth hormone, you will fill all these criteria. Finally, my take home message is that the growth hormone injection devices with features that facilitate convenience and ease of use are valued by the patients. So take care of this. And the ease of use of norditropin, it will improve the treatment adherence that will ultimately optimize the clinical outcomes of your patients. And please, don't forget that the wastage of growth hormone influences the choice of the injection devices from the economic perspective. So take care of the cost-benefit ratio and also because of the wastage of the growth hormone during injection. And finally, this is Messi, the smallest boy with the biggest dream, one of the famous football players. I hope all our children with growth hormone will achieve this journey of success. And finally, thank you again for being with my dear professors and colleagues in Mansoura University Hospital. Hope next year we will meet face to face, inshallah. Assalamu alaikum.